Hello everybody. Today we did another revision rhinoplasty, but our topic of the day is Pollybeak deformity. So first of all, let's go through the plan. So Lindsay came in and she said that her tip was deviated. She also had nasal obstruction, and when she smiled, her tip would move down. And that's why we put the septal extension graft to help straighten the tip, prevent it from falling down when she smiles. Also, her bones were a little wide. She was a little bit caved in on the right side of her, the middle vault of the nose. Plus, she couldn't breathe because she was collapsing. In addition, the right nostril was a lot higher than the left. She also had this hump here, which we didn't know if it was cartilage or scar tissue. And then she wanted her tip lifted up a little bit. So let's go to the photos. It's finished. Here she is. You can see that bump, and you can see the way the tip is. And now you can see we rotated the tip, made it cuter, removed what we call a soft tissue polybeak. We'll show you that in a minute. Go to the next one. Here she is again. This is on the table. So she will get some more swelling here because I pushed out the swelling, but that's after removing the tissue. Gives her a cuter nose. And also this is called the rotation compared to here. It's kind of straight. And then here is giving the nose a little cuter of an angle. Next. Now, when it comes to obstruction, and by the way, she's going to be swollen here, but this is collapse, where inside the nostrils she's collapsing, and on the rim she's collapsing. So this is before we close it up. This is the way it looks now. It's open. It does appear wide, but there's a lot of swelling here. So this is on the table, but the nostrils are a lot more symmetric and they're open. Next. From this view, the tip is deviated off to the right, and she's caving in right here, and this bone is sticking out a little bit more. So now when we look here after fracturing the nasal bones, the bones are straight. This is swelling, but this is now also straight. And now the tip is perfectly right in the middle. You can see the top right here, straight on line, right in the middle of Cupid's bow area. Next one. So here's another view looking down. See how the bones are a little bit uneven, and this part's caved in, tip deviated, and that's our collapse. That's why she can't breathe. Now again, you'll still, after about 3 months, you'll still get some of this to come in, and you'll have a little bit of a nice, gentle indentation, but it's straight. And again, in surgery, it's swollen right now. Next. And here's one more view looking down. So this is it. This is the soft tissue polybeak scar after her first rhinoplasty. And go ahead and take a look at that from the side. And so we just took it out right from there. So this is what we remove now. Can that come back? The answer is definitely yes. So what we have to do is make sure when we're done here, we tape her very well. Then we'll tape her for the second week, and then we might even have her tape every night for about 6-7 weeks. And then if she needs to, we'll put in some 5-fluorouracil and some mild Kenalog, a steroid, into this area to prevent this from coming back. So here's our space. Okay.